Good morning, all. It's a pleasure to meet up with you again. I hope the first episode was very useful about the acute suppurative arthritis media. Today, we are going to talk about something equally more important than the first one, which is known as pediatric sleep apnea. You all may be surprised, what does it mean by pediatric sleep apnea? Yes, just like how it affects adults, it also affects children in a very big way, and the majority of the time, it's being not noticed and the child suffers and the parent gets anxious. I had parents who have taken their child to a psychiatrist or psychologist thinking it was attention deficit hyperactivity disorder, only to find it was a pediatric sleep apnea. So let's dwell into the topic in more detail. Now, what does it mean by pediatric sleep apnea? What is sleep apnea? Sleep apnea is a condition where the oxygen doesn't go to the brain, and pediatric sleep apnea is a condition where it occurs more often in children. Now, here comes the differences. In an adult, if you have sleep apnea, you'll feel tired, you'll feel sleepy, and if you're just sitting idle, you most of the time you'll find that you're just dozed off. In a child, it's a reverse, where the child gets extremely agitated and is extremely hyperactive. See the difference? In adults, it is tiredness. In a child, it is hyperactivity. So, whenever a parent brings a child, I just observe the child. I don't do anything. I just keep on talking to the parent, but I'll be observing the child in the corner of my eye. And then I ask the parents, is the child always so hyperactive? And they almost always say yes. So, does it mean that every hyperactive child has got pediatric sleep apnea? No, not necessarily. It could also be attention deficit hyperactivity disorder, but it's always better to rule out a much common and easily treatable condition. So, what causes this condition? Sleep apnea occurs whenever there's going to be a blockage in the airway path. So, it could be in the nose, it could be in the throat, and in a child, generally it's not because of the turbinate. In adult, it can be because inside the nostrils there are structures known as turbinates. They get swollen in adult because of allergy. In a child, allergy is common, but it doesn't cause the swelling because it takes such a long time of for the turbinates to get swollen. But it irritates a tissue known as adenoids. So, what are adenoids? The adenoids are tissue at the back of the nose. Here I have showing a picture of the adenoid which I have taken on table. So you can see those are all glandular structures, and when it gets swollen, it blocks the nostrils completely. And what happens because of that? When the child is lying down, child always does what we call it as mouth breathing. And that leads to few things where there's a facial asymmetry, where you can see the teeth come like this in the front. So the child starts opening the mouth and breathing. So the tonsil starts doing the work of the adenoids too. So it gets swollen, blocks, and then the child again struggles and all that. So, and the other things like the tongue hypertrophy, the collapsing airway are all extremely rare in children. So let's stick to the very common one, which is the adenoid and rarely the tonsil hypertrophy. So what do you do if you got an adenoid or if you suspect the child has got a pediatric sleep apnea? Adenoids, you'll be doing X-ray. Otherwise, you can request the doctor whether you can take an X-ray. Yes, there is some amount of radiation, but that is too meager to affect the child, and the benefits are huge. So, did you see the facial asymmetry? It's very classical. And if you go to a dentist, they always say, first roll the adenoids before I put a clip. And the next thing which can happen is because of the secretions getting blockage and because of the nose getting irritated, adenoids getting irritated, there is thick mucus. Thick mucus, as you can see in the next picture. Hitting the throat, the child starts having chronic cough. The parent takes the child to all the doctors. They'll be putting them on anti-allergic tablet, which is not going to benefit the child because it's not because of allergy, but it's because of blockage and anatomical blockage. Or sometimes they even start putting in them the child on some asthmatic medications, which is all not going to help. And then the parents get anxious, the child gets anxious because when a child keeps on visiting doctors, the child gets jittery, something is wrong. So this is adenoids is the first part. The second thing can be because of huge tonsils. Generally, the tonsils, what we call as kissing tonsils, where the tonsils come in the middle and completely blocks the throat. I have shown the picture here. This condition is seen whenever there is adenoid hypertrophy. Why? When the adenoid is blocking the nose, survival becomes a priority for the child. So the child starts opening the mouth and breathing. So the tonsil starts doing the work of the adenoids too. So it gets swollen, blocks, and then the child again struggles and all that. So, and the other things like the tongue hypertrophy, the collapsing airway are all extremely rare in children. So, let's stick to the very common one, which is the adenoid and rarely the tonsillar hypertrophy. So, what do you do if you got an adenoid or if you suspect the child has got a pediatric sleep apnea? Take the child to someone who specializes in pediatric sleep apnea or something, a pediatric otolaryngologist or a good ENT. Now, any specialist can be diagnosed provided they are able to just identify it in the first go. Adenoids can be diagnosed by anyone. The hyperactivity is a kind of a gray area where, since I see lot of children, I am able to do it. So take them to a ENT doctor, and if the ENT doctor suspects adenoids, he'll be doing X-ray. Otherwise, you can request the doctor whether you can take an X-ray. Yes, there is amount of radiation, but that is too meager to affect the child, and the benefits are huge. So now you have diagnosed that child has got adenoid. What are you going to do? Is surgery the only option? No. I always, I differ from others. I always try medical management, and I tell my parents only if the medical management fails will they discuss about surgery. So the medical management is kind of an intranasal steroid spray, which I give it twice daily. I don't want to tell the name of the medicine and all that. Now, I get lots of parents who get, oh, steroids. I say, yes, steroids. Is it safe? I tell them it's much more safer than your online food delivery. Okay, now, it's even worse than your regular food you're eating. In Bangalore, there has been a study which shown that all the fruits, vegetables got heavy metal. So, all allopathic medicines are pretty much safe if taken in the proper recommended dose. So, next time before you ask a doctor, oh, is it safe? The doctor doesn't know and all that stuff. Just understand, doctor knows much more better than you. The doctor has spent close to about 25 years studying, and rather than just spending 25 minutes in Google. Okay, so that's point number one. So give the steroid spray continuously for about, I generally prefer to give it for about 2 months, though some people give longer duration of time. I always say if there is no recovery in 1 or 2 months, there's not going to be any recovery even after 1 or 2 years. So if the child is still struggling and all that, it's much more safer to take the child for a surgery rather than waiting, because pediatric sleep apnea causes so much of problems. There is lack of concentration for the child. There is always complaint from the school teacher saying that the child is not concentrating, is extremely hyperactive, disturbing others. Next, there can also be fluid accumulation in the ears, which leads to hearing loss, and again, which leads to the studies getting affected. Three, the child will not be able to eat. So there is a condition known as failure to thrive. Failure to thrive. What does it mean? Again, as earlier I told you, the first instinct of the child is to survive. So if you're going to give him food, the mouth gets blocked. That is the only way the child is surviving. Otherwise, where else oxygen is going to go? So what does the child do? It immediately either gobbles the food, waits for some time, or refuses to eat food to eat, because if he's going to keep the mouth open, chew, then he's not going to have oxygen and he's not going to be comfortable. So all these problems comes. And nowadays surgeries are very safe, provided all precautions are taken. What are my precautions? Generally, the anesthetists will be assessing, doing everything. And previously, there was fear of bleeding and all that. Now there are advanced equipments. I use something known as a coagulation technology, which is very safe, very fast, and the risk are always there, but the risk are extremely minimal, but the benefits are huge. Generally, again, this is as far as I'm concerned. I don't know about others. I do not remove the tonsils. It's been more than 20 years since I removed my last tonsil, because I always say the organs are there for a specific purpose. So even in conditions where there's a huge adenoid, there are kissing tonsils, I do not remove the tonsils. The people may think, oh, you're doing a half-hearted job now. It's because once the adenoid is removed, once a child is able to breathe through the nose, the tonsil is relieved of its overfunctioning. The main purpose of the tonsil is, to just capture the bacteria from the food or water which goes, so to that it can protect the inner organs. So here it will start doing only that function. The size of the tonsils also start coming down, and the child should be fine. But before I take the child for a surgery for the adenoids, I always tell them the child may require a tonsil surgery in the future, but so far I not had that the problem, but still it can happen. The only thing which can happen is the child will have continuously throat infection for the next 3 to 4 months, but that's fine. After that, the child becomes normal. So, what is pediatric sleep apnea? It is blockage of the nose or the throat, which is preventing oxygen to go into the brain. And most common thing is adenoids. Treatment is either medical or surgical. I'm not going to go into the details of the adenoids and all that, which we will discuss about the adenoids in a separate thing. But understand, pediatric sleep apnea is a very serious thing. So if you notice a child to be hyperactive, or if you think your child is not hearing well, or if you think the child is having what you call as a failure to thrive, wherein he's not eating much, or there's complaints from the school, it's always better to roll out pediatric sleep apnea, which is as serious as an adult sleep apnea. When I say serious, it's not about the life and death, where you see in the newspaper and all saying, oh, he died of heart attack and all that. No, all those things will not happen. But the child's of quality of life is going to be hindered, that is going to affect his overall growth in the coming years. So I hope you like this. Please keep watching our channel, and in the next thing, we'll talk about another interesting topic. Thank you.